Welcome back. Breast cancer remains a serious health concern in Namibia, with more than 540 new cases recorded annually. Historically, this number is set to increase drastically. To address advanced breast cancer and metastatic breast cancer, Cancer Association of Namibia has partnered with Roche Pharmaceuticals to sponsor a breast health indaba this week in order to welcome in Pink October. To share more on this, I'm joined now by Tarekoya Shiryange, who is the Cancer Registrar, Patient Support and Youth Engagement Officer at the Cancer Association of Namibia. Tarekoya, good evening and welcome.
Good evening, Nina, and thank you for having me.
Thank you for being here.
Yes.
I want to talk about, some of the challenges. What are the main challenges that Namibia faces when it comes to addressing advanced breast cancer and, of course, metastatic breast cancer?
Okay, yes, we've in general right now, when ladies present with either cancer symptoms and everything, and once you're diagnosed, it becomes, it's either metastatic or at a later stage. Now, the problems that we are currently facing is just how the patient in general just respond to the treatment that they are given, because, when it is staged at the very last stage or latest metastatics, it's hard to actually treat that patient. And then the other issue is also just, patient follow-up, because sometimes it could be that you might have patients that just do not reach or come back to their follow-up on time. And these are maybe sometimes just due to, either a lack of access to transportation to come down to an oncological treatment center. Yes.
You're having this breast health indaba, which is sponsored by the Cancer Association of Namibia. Talk to us about the objectives and the goals of this indaba.
So when we kicked off Pink October, we wanted to understand on the grassroots level what are the issues that primary healthcare workers are facing within the rural areas, and how better we can actually tackle them and just mitigate the risks of advanced breast cancer in women and men as well.
And what are some of the challenges that they face in these areas?
Most of the challenges would then be access to healthcare, and also, the educational factor that is now are we within our plans of, primary health care aware enough of that the fact that cancer is also, a primary factor and a primary, disease within the community that should be screened at a very earlier stage. So it just comes down to either, the screening methods that we're using in terms of, are we screening the patients as they come in, or are we also educating and making the patients aware of breast cancer and the importance of actually screening at a primary health sector in order for us to basically, refer them into the right channels of referral.
Tarekoya, who's most at risk of breast cancer?
Women of the ages, today we spoke about it. Women of the ages of 30 upwards are most likely, are at risk of breast cancer. However, we have noticed that you also have, ladies and young adults from the ages of 20 presenting with late stage diagnosis of breast cancer. So the initiative today, when we spoke about it and when we had this indaba today, it was more on, trying to sort of bring down the age of importance in terms of focusing on ladies' screens and stuff. So we are now sort of saying that, okay, from the ages of at least 25 onwards, we need to actually really educate the ladies to come forth in terms of breast cancer screening.
Yeah. What's the indaba going to entail? What's it? Talk to us about how it will unfold.
So we started today, and I believe today was just the beginning. So the idea was to bring in healthcare workers, everybody within the Ministry of Health. We did have Ms. Masibane, the Deputy Executive Director there, who actually really did say a few promising words, that really ignited a fuel within us. And the idea in it all, like I said earlier, was for us to find a way to bridge the gap between primary healthcare and secondary healthcare, just to mitigate and make sure that by the time the patient comes in by presenting with the symptoms to the time of treatment is actually shortened as compared to what it currently is.
Yeah. Is breast cancer still the most common #1 cancer?
Currently, yes, as we're speaking. However, yes, we are looking at prostate. That's actually becoming quite a problematic cancer. And both of these cancers are lifestyle cancers, and hence we always, advise patients to look at either their dietary ways and also either the ways of living and what what they are doing, because both of them are actually lifestyle
I
cancers.
think a lot of people are not aware of that you know, this is a lifestyle cancer, and they would question themselves like, what can I do different? So what can you do different to prevent, you know, yourself and keep yourself healthy and fit and prevent these situations?
You know, when you look at obesity, for example, can also be a way of, you know, that can trigger cancer. Lifestyle cancers are mainly also either triggered, you know, they are manifestations of what you do currently. So eating healthy and having a healthy mindset, and just, you know, abstaining from certain intakes of either amounts of alcohol and cigarettes, you know, because they have carcinogens. And carcinogens are these agents that obviously trigger the activation of cancerous cells within your body. And so all these little factors, the little glitches that you add within your life, can actually lead to you having this form of cancers. And like, you know, breast cancer can also be hereditary, you know, inherited. When we always say, you know, when your mom or anyone within your family had breast cancer before, it's important that you then start your screening at an earlier stage.
Yeah, you're more likely to also then have breast cancer.
Or either your generations after that as well.
You mentioned that one of the issues that were raised at the start of today's indaba was, of course, bringing the screening age down to 25 amongst young women. What other issues of concerns were touched on during this, you know, the opening today?
The main issues that we touched on was the time that it takes from for a patient to actually get biopsied or get sonared. And this is when you are present, because we have, I like to say that our referral system is actually a good referral system. It's just a matter of, by grassroots level, our healthcare practitioners, we need to sort of maybe have what you call a refresher in order to understand that, you know, breast cancer should be screened. And then the moment you then realize that, okay, there is a lump here within the patient that came here, then we can refer. Now the issue is then the referral path. You might take, you know, 6 to 7 months even to get that sonar that you need. However, we have then obviously worked on what are the plausible solutions within that to just basically bridge that time gap to from patient presenting herself to the primary healthcare worker to actually coming down to the diagnostics and also treatment.
In terms of Pink October, what are your plans around raising awareness for this? Any campaigns planned?
Yes. We started off with, you know, the indaba, just to see where we are going and what we need to achieve. And yeah, we now are trying to push our focus on just basically educating our healthcare workers, and not really educated, let me just say rather just making them aware that this is also an issue, especially within the rural state of Namibia. And we do have the Heads and Roses that the Cancer Association has annually within October. This one is usually just aimed on raising funds and basically also just raising awareness in terms of helping not only breast cancer women, but however also just women in general that are battling cancer, and just reminding them that, you know, you are not alone within this work.
What support does the Cancer Association of Namibia offer patients and family alike, and of course, how can they access this, these services?
Our most important form of support that we offer is usually psychosocial support. It's very important that we understand that we know when the patient is diagnosed, in most cases they are not aware of what the cancer is or whether it is cancer and what is cancer. So just being able to making them understand that, you know, you do have cancer, this is cancer, and we are here to, you know, take you through this whole process. Like we always say, you know, initiate change, you know, activate hope and inspire, you know, lives, in order to basically just have that hope in the sense of, you know, carry on and keep fighting. So psychosocial support is very important, especially when you're also including a patient or a client that has a husband, because sometimes it also takes a toll on the family members. Hence why we have what we call the circle of hope, and that's just where we bring families and sit them down and we just engage with them, just try to make them understand the situation that they are in, and also just understand that it's not the end of the road, that more can be done only when you change your mindset and just have that glimmer of hope somewhere there. And also obviously the other one would then be our financial support that we usually offer. offer to all the patients that are diagnosed with cancer.
Of course, when it comes to cancer, they say early detection is key. The earlier you detect it, the better chances you have of getting rid of the cancer. Are there any initiatives that the Cancer Association has in place for early detection, and how effective have these initiatives been?
We have had the Cancer National Outreach Program with the sponsorship and help of the Bang Windhoek Cancer Apple. They have been quite helpful. I mean, over the past 3 years, we have screened over plus minus 6,000 women for breast cancer, and then within that we had a few referrals of 560 at least to go to the breast clinics and everything. This year we have started one initiative which is the breast clinic at the Windhoek Central Hospital. Currently it's just mainly working with a lot of patients from Windhoek and the Commerce region, or closer to the Commerce region, but the plan is to move it out to the major regions. So the aims of these breast clinics that we are having is basically to just, if the primary healthcare workers at grassroots level notice that, okay, this is a lump, we don't actually need to send them either through to a sauna or through to a sauna, then we can just send them straight to a breast clinic where they can be biopsied immediately. So this actually then bridges that little gap that I was talking about in terms of time from presentation to time of treatment.
Yeah. What are some of the key messages or information that you hope to convey, during Pink October, and also, of course, with the indaba, in terms of raising awareness around breast cancer prevention, early detection, etc.?
Yes, a takeaway today for me was more on, any chance a patient presents themselves to the hospital is a chance that the healthcare worker can also screen them. So it just, the focus right now has more shifted rather from the patient to now the healthcare workers. Right. The moment a patient presents to you, especially when they are coming in for family planning even, that's when you can maybe initiate that conversation and ask them, have you heard of breast cancer? Were you ever screened of it? Do you know the procedures to do your self, examinations? Or do we need to do, because that's one of the main initiatives that we're also trying to push in and stuff. And then the other one, just when it comes to the patient itself and whoever is, listening and watching, your health matters. The moment you start taking initiative within your own health, any slightest change within your body, you would notice. And one would always say, the moment you feel uncomfortable, run to the nearest medical care center and fight until you get that treatment, because sometimes delays might happen due to procedural measures, but please do not give up until you get the assistance and the help that you need.
Tarukuya, thank you so much for being here. Always lovely having you with us.
Thank you so much for always having me, Nina.
Well, there you have it. We're going to be taking a short break. When we come back, we speak to our Woman Crush Wednesday.